Welcome to our channel, where we delve into crucial healthcare topics and their broader impact on our world. Today, we're addressing an issue that affects us all, the global water crisis. It's a situation that's becoming increasingly dire, with half of the planet's population facing severe water scarcity. But why are we talking about this on a healthcare channel? Because the way we use water in our intensive care units, ICUs, has profound implications not just for patient care, but for the health of our planet too. By the end of this video, you'll have a clearer understanding of how ICU practices can contribute to water sustainability and help combat the looming threat of AMR. So, let's dive in and discover how we can safeguard our most precious resource and protect the health of patients and our planet for future generations. Stay tuned. In our ICUs, a critical healing space for the most vulnerable, a hidden environmental challenge lurks in the form of water and pharmaceutical use. Let's unravel this complex cycle and understand its implications. In ICUs, the use of IV bags and water risks environmental harm. Bags leave waste and carbon footprints. Water may spread bacteria, leading to infections. Used antibiotics, excreted into wastewater, often remain active. Standard sewage treatments don't fully remove these, letting them enter ecosystems and potentially fostering antimicrobial resistance. This calls for sustainable healthcare practices, minimizing plastic use, strict antibiotic stewardship, and improved wastewater management to safeguard health and the environment. Here are 5 tips to help reduce water crisis in ICU. Tip 1. Adopt water-free patient care in ICUs to address tap water risks, where wastewater organisms, including antibiotic-resistant bacteria, can infect patients. This proactive measure, supported by studies, reduces undetected infections and healthcare-associated risks, proving more effective than traditional water use practices. Tip 2 emphasizes the significance of the ICU's physical layout in infection control. Influence on infection rates. The design and utilization of ICU spaces can play a pivotal role in influencing infection rates, with the potential to significantly prevent infections. Preventative measures. Strategies like redesigning spaces to minimize bacterial spread from tap drains can reduce the need for intensive surveillance, thereby decreasing resource usage. Dual benefits. By lowering infection rates, not only is the environmental impact reduced due to lesser resource demands, but the risk of healthcare-associated infections is also diminished. Adapting hand hygiene. Adhering to hand hygiene protocols by situating sinks outside patient rooms can effectively reduce the transmission risk without compromising on infection prevention measures. Tip 3 focuses on optimizing IV fluid use for both patient well-being and environmental sustainability. Waste concerns. IV fluids, while essential for ICU care, lead to substantial waste, exemplified by a Dutch ICU's annual disposal of 13,600 kilograms of IV bag and packaging waste. Environmental considerations. The environmental cost of producing and disposing of these materials is significant, underlining the need for sustainable practices in healthcare settings. Clinical implications. Inappropriate IV fluid administration can result in complications like hypervolemia, potentially leading to organ dysfunction and increased mortality. Stewardship approach. Implementing fluid stewardship, which involves precise assessment and administration of IV fluids, can prevent overuse and its associated risks. Dual advantages. A careful approach to IV fluid use not only enhances patient care but also contributes to environmental protection by reducing waste. Tip 4 advocates for minimizing antibiotic use through stewardship. Prevention first. Prioritize infection prevention to reduce antibiotic reliance. When needed, use antibiotics responsibly, guided by stewardship principles. Antibiotic Stop Policy, ASP. Implement ASP in ICUs to set clear end dates for antibiotic treatments, particularly for culture-negative infections, to prevent overuse. Structured review benefits. Trials like ARC Hospital show that reviewing antibiotic use can lower consumption safely, emphasizing the effectiveness of structured stewardship programs. Broader impacts. Reducing antibiotic use not only curtails the spread of antibiotic resistance but may also lessen environmental harm, highlighting the need for further study on its ecological benefits. Tip 5. Advanced filtration for wastewater management. Issue: patient-excreted antibiotics end up in wastewater, evading standard treatment and contributing to antimicrobial resistance, AMR. Impact: antibiotics in water systems can cause bioaccumulation and toxicity, fostering antibiotic-resistant bacteria. Solution: technologies like PharmaFilter effectively remove these contaminants, mitigating AMR risks. Adoption: making such systems more accessible and user-friendly is key to widespread use, reducing healthcare's environmental impact and addressing AMR. So the take-home message are: ICU professional responsibility. ICU staff are pivotal in tackling water scarcity and hazards, with their practices impacting global health and future generations. Sustainable ICU practices. 5 strategies are highlighted for water sustainability in ICUs, focusing on various operational and care aspects. Stewardship programs. Essential for clinical staff, antibiotic and fluid stewardship programs enhance patient care and reduce environmental impact. Management's critical role. Leaders must focus on AMR and infection risks with solutions like water-free care and improved wastewater treatment. Unified healthcare effort. Sustainable water use in ICUs demands a joint effort across healthcare roles, ensuring patient and environmental well-being. Thank you for joining us in exploring sustainable practices in ICU water management. Together, we can make a difference. If you're in the healthcare field, consider how you can apply these strategies in your workspace. For everyone else, let's support policies and initiatives that promote environmental sustainability in healthcare. Share this message, advocate for change, and remember, every action counts towards a healthier planet and future. Don't forget to like, share, and subscribe for more insights.